All right, and go ahead and call to order this regular meeting of the Seneca Healthcare District Board of Directors. And we are gonna do our roll call. Shelley is here, Sherry's here, I am here. Rich, are you online?
Yes, I am here.
Thank you. And Ken, I don't think he's with us yet. He'll be joining, but he won't be able to vote since he wasn't recognized that way. So let's go ahead and do the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you all. That brings us to item number 2, additions, modifications, or deletions from the agenda. I have none. I have none. All right, that moves us to item number 3, approval of the agenda. I have a motion to approve our agenda.
Move approval.
Thank you. Do I have a second?
Second.
Thank you. All in favor, Shelley?
Aye.
Terry?
Aye.
Rich?
Hi.
And I will vote aye. That brings us to our public comment period. I don't think we had any public comment submitted in advance of our meeting. No. Anyone here or online have anything they wanted to make a public comment about? Okay. Then that will move us on to item number 5. Welcome to our distinguished guests for the Lake Anwar Cancer Fund introduction and presentation. Kate and Chelsea, are you guys just gonna both do it or? Okay,
Yeah.
all right, thank you.
Just more of an introduction of who we are and why we're here, here we go. So that's our we did bring in some brochures, so that we can hand out a little later, because it's just kind of basically the same kind of thing as what you're gonna see up here. But of course, we had to show some of our beautiful landscape along the way, thanks to Jake Edwards, who allowed us to use quite a few of his pieces. So you can go ahead, this is obviously what our focus is, which is we are here so you can focus on your well-being, which all of you definitely understand all of that. So I know we're preaching to the choir here. Go ahead. And then this is basically what we're going to go over today, which is super simple, and that's why we won't take too much of your time. But where we came from, where we're going, how we're going to get there, why we are here, who is behind the scenes, whoop, whoop, and then how can we help you, and how you can help us, and how we can help you, and then our contact information. So in a nutshell, I know you can absolutely read, but there was a family that needed some assistance. So a group of their friends got together and said, we need to financially help them, and created a 501c3. So the original intent was for a specific individual, and then they were not going to do anything with it. I happen to be really good friends with 2, or well, actually all of them. And I simply asked, what are you guys going to do after that? And they said, well, that's not something we want to move forward with. And so I said, can I have it, please? Can I have it? And they said, absolutely. So, so I started working with, actually, I started out asking for some referrals, and Stephanie White came up through 3 different people. And then Jessica Dowling, who is a cancer survivor. And so the 3 of us spent time working on all of the structure for about a year. And Stephanie's mom was very instrumental in that process as well, Virginia Hargrave. And then we were able to actually recruit Cassie and Tessa for a short period of time as well, to help bring in some of their knowledge as well. And that's basically where we came from. So where we're going, basically help those with cancer-related needs, and focusing on their well-being, the main, and actually I think we'll get into that in just a minute on what we've done, but ultimately, and again, like I said, I'm not going to read it because I know y'all can read. So, but where we're going is just helping as many people as we can. And how we're getting there. So this Saturday is one of our how we're getting there opportunities. El Lago last year, we started connecting with Stacy, and she had offered the high school a dine and donate option. And I had tried to keep that and tried to get the high school to do something, didn't work out. So I said, I've got this new organization I would love to try. a dine and donate with you, and we had enormous success. So not only did we raise, I want to say 700 just the day of, but then it's also a donate. So whatever was purchased that day, she also donated. That was $1,000 just from El Lago. Now, since we're a 501c3, we were able to also help her with that, her contribution that she provided us as well. So it ended up being a win-win for the business because it's a shoulder season. As we all know, this is one of our slowest times of year. And so it helped her bring in some business and then also us some awareness. And then she also got to help support a new organization that we're trying. The other piece that we did is, so Brenda Lemons, if you're not familiar, she also has a family member who is struggling with cancer. And so she offered the coffee station as well. And we did sip and support, which was even larger of a success. We had a very amazing turnout, but it is a different size ticket number, right? Because when you eat dinner compared to when you have coffee, it was pretty close. Just saying, because that's how much coffee and muffins that we ended up being, and breakfast sandwiches that she was able to provide. And it, same thing, February is when we do our sip and support. Tell me who's here in February. Mm-hmm. Exactly. Exactly. So, but it was a huge success. And then we actually had quite a few pass through traffic stop because they saw the balloons and they saw support. So they stopped to find out what it was about, and they were absolutely, we're so pleased to be able to support this type of a venture. So ultimately, that is, we only do the 2 items, and I'm sorry, Kate, because I do tend to monopolize. So, what we also do is offer opportunity for someone who wants to host a fundraiser for a specific project. So if, Tim, give me a second. Oh, Lordy. Yeah, it's right there to my tongue. Chester Auto Body is, y'all help me out. This is horrible. I know, Tim Langer, Lordy, I'm so sorry. Anyway, same thing, had a family member and he hosted, so we provided him the 501c3 to process, and we also are there, so we are a part of it, but they do all of the work. So, because there's only very few of us. And so they do all of it, but we just help them get through that actual process, and they get the benefit minus the online option of donations that they unfortunately get dinged for, that we can help with that safe process. Next, oh, sorry, I hate saying next, so I apologize. And then going back to and reiterating why we are here, which is to help support those with cancer. And this is a quote from the family that this started from, and on how instrumental it was for her to be able to get through the process for losing her husband. We can move on. Mm-hmm. So behind the scenes, myself, Chelsea Harrison, because I didn't quite introduce myself, so I apologize. So Chelsea Harrison, Jessica Dowling, who moved here a few years ago. Our sons went to school together. She is a cancer survivor. And then I will stop and let Kate introduce.
My name is Kate McDonald. I'm a registered nurse who recently retired. And so I was first introduced to this organization as the hospice nurse of the original patient. And so I'd heard about the benefits of it. And then when I was hearing more, I was excited when I was asked to join. I'm a long-time oncology nurse. I ran Feather River Cancer Center in Paradise for a lot of years. And so I understand the importance of a organization like this. The cancer diagnosis is devastating to not just the patients, families, but also financially. And so any way that we can help is very, very important. Okay. One of the other roles that I play is the education and prevention. And so we recently started writing little articles about cancer awareness, cancer preventions, things like that. And I'm hoping to continue in whatever way I can help. Chelsea does everything, and so really I'm just here to offer whatever support I can do.
And it's definitely the knowledge, right?
Yeah.
It's not a world I'm used to or understand 100%, but I understand how that the goal is to help people, and that's what I'm good at.
Sometimes they ask me, because medical people are weird, I can say that because we're all. we speak funny and we do all that, and so I do a lot of interpretation,
Don't
yeah. What does that mean, you know, so that's my role.
And-
That's important.
Yeah, it's important, yeah.
Yeah,
Yeah,
yeah.
let me tell you what they actually said.
And then we were really excited to add Vicki Thompson to our team as well, with her being associated with Wildwood. We have been doing a lot of discussions, and again, what we offer, actually, do you kind of, anyway, here or there, is the nutritional value. So actually, Jessica shared that it was very difficult, even living in San Jose, when she was going through her first incidences of cancer, that she couldn't find someone to help her with her diet. And that was a real struggle. And she was a stay-at-home mom-ish. And so she was taking care of their children. So when it came time for her husband to have to cook, yeah, there was no cooking involved. And then a lot of those smells she couldn't handle. It made her sick. And so she was already sick, and then having that struggle there. So that we found that to be a very large need, and in general, so that's something that we want to provide. And since we have a great facility that's already offering the low sodium, all the meals that we could either mirror, or we have people sponsor, and then we have a crew that then help deliver. And then also family groceries, so there would be bag groceries at Holiday Market, so the family can just grab a bag and go. They don't even have to think about what they need in the grocery store. And then we keep it really simple. So that's a development stage is where we're at with that one. And then just really wanted to share again, who was instrumental on us starting. And because it really did take all of them for a year to make sure that our structure and our, as all of you know, just how the foundation has to be solid before we can really go anywhere. So, because we didn't want to react anymore. It was a matter of making sure we were 100%. So we had a great team to do that. Okay, so how you can help. We had just finished our brochures. They are very simple, but we are just looking for you to help refer. So we would love for those that, whether whatever stage it is, because that's where I do not understand this world at all. All I understand is I want to help people. So whatever capacity that you feel that you can be a part of, to send them our way, because we actually have a little bit of a bank already. And these, and then they end up just kind of filtering in, and it's amazing what, just a quick little, are you interested? And we do. Now, there are absolutely no funds that are donated are used for our overhead. We all, our board actually invests personally to make sure all of our overhead is covered. So there is no holding 5% so we can hire somebody. That's not going to be the case whatsoever. That is absolutely not in our mission plan at all. So, so I'm very excited about that. And then we can.
Yeah, one of the other things that we're looking for is a better way to connect to the cancer patients in our area. We're going to be reaching out to both Enloe and Rideout's cancer providers, but we're wondering how we could do that locally.
Yeah.
Do you guys have a medical staff meeting or anything that we could, maybe present at? How best to do that? Should I contact Debbie or?
I will talk with Joanne.
Oh, okay.
They build the agenda, so
Okay.
we'll talk to Joanne, which then we would talk to Dr. Ware, who's chief of staff.
Okay.
Or Dr. Nielsen, when it happens.
Okay,
And then, they'll contact you and agendize something,
perfect.
so you can.
Yeah, and just the staff, just to
Mhm.
make sure if they have a, oncology patient coming through, to hand them our brochure and say, here's somebody that can help. So,
You get idea to get these brochures in each individual office.
yeah.
And
Part of
the
the brochure
department
retreat.
too.
Oh, and the ER too, yeah.
Yeah.
Any other suggestions on ways we can do outreach?
Well, so many of us
Hmm.
get to visit the cancer center for Enloe,
Uh-huh.
Chico.
Yeah,
And I would say having some of these
Mhm.
available there, because, they may not necessarily be filtered through their
Right.
provider,
Yeah.
let's say, once they hit down there, so.
And I had a couple suggest over in Renown as well,
Mhm.
because they're seeing some doctors at Renown and not.
I think that would be very helpful. I have one question for you too. I remember when my husband was diagnosed with cancer, and one of the things that really seemed to be really important to a lot of the people that he knew that were going back and forth through radiation and stuff, was, helping defer the cost of gas.
Mhm.
So is that something that,
That's been our majority of our contribution has actually been in either hotel stay or gas.
that's great,
Because travel expenses, we understand is not covered.
right?
And this application is real simple
Mhm.
and there's no
Mhm.
economical
Mm-mm.
questions or anything like that.
Nope.
So.
There's sphere of influence.
Well, we'd like to be stronger, but obviously, the Lake Alamo Basin and, you know, Chester and all of that area, so.
Yeah.
And we don't even really define, cancer treatments, so whether you're, you know, have a basal cell cancer versus a, you know, much more lengthy one, if you're having a financial difficulties, if it's impacting you in any way, we would encourage them to reach out to us.
And the process from when they reach out to you, you talk with them, give them an application. How do you kind of pinpoint down to what their true needs are?
Yeah, so we don't really do that. That's what's, so we follow, kind of just if they're applying for it, you know, unless there's a real red flag, we're not going to filter that at all. We're just gonna provide them with funds.
Okay, so they'll tell you, you know, I have to have these treatments and go to Chico
Yeah.
these many times.
Yeah.
And I'm going for
It's-
gas.
It's a
We're not-
checkbox
yeah.
situation that you need it for hotel stay, you need it for gas, you need it, we just keep it really that simple.
Okay.
Yeah, and then we have put limits on it, but you can request multiple times. So that way, and then
That's what I wanted to
between,
find out.
yes. And then as our funds increase, then we can increase that, but at the moment, our first, our policy is up to, I think 500 is what we're
500, yeah.
currently doing, and then we reevaluate after they feel they need again. Mhm. And then we, one of us on the board stays connected with that patient the entire time, so they have a point of contact the entire time.
That's nice.
Mhm.
That's really great.
Yeah, and since Jessica and Kate are very well versed in it, it does end up weighing on their shoulders.
Spread the.
Yeah, I just signed the check, you know.
Kate,
Mhm.
you're probably connected with Dr. Khan.
Yeah,
Yeah.
we're good friends.
and Tracy, huh?
Yeah, yeah, so that's our next step. We just made the brochures, and so we're just starting. So I'll go reach out to the case managers and all of that.
And you're step one.
Yeah,
Yep.
yeah, so,
Again, we wanted to make sure we had a solid foundation first.
yeah.
You know, in LAW where I live,
Mhm.
there's a bulletin board.
Mhm.
And I'm thinking this might be a good place for this to reside,
Okay.
a bulletin board. Have
And
to have two.
Is that at
to
the
start.
restaurant?
It's actually, there's more than one. At three, I think there's three.
Oh.
Three,
At
at the mailboxes.
The
There's
boxes,
actually
okay.
three boards.
Okay.
Yeah.
Well, in and on that, I guess, there's newsletters, various newsletters around the basin too.
Mhm. Yep, and so that's where we put our articles now, is the chamber newsletter, so we are a chamber member, so we do utilize that as one of our vessels for information, delivery. Mhm.
I think a lot of people have this idea that they don't deserve help, you know, so we're really trying to get over
Mhm.
that. So, you know, if you know of anybody that is going through cancer treatments, you know, just make a phone call and, you know, we'll literally walk them through the process, and it's really easy, and they deserve some support.
And that's, I just met a gentleman yesterday, who just exactly that, but is gonna have to do an overnight for a specialist and realized, you know, why do I need to take on that burden? Cause it is, and it's not easy every month, so he'll be sending an application, so. Yeah.
Yeah, and I think that what you're talking about food, the food program
Mhm.
is huge.
Yeah.
And that's something that, partnering with Wildwood is wonderful.
Mhm.
Number one, because they have the facilities and mostly know who they need to
Mhm.
Right.
contact. And I can say, you know, the smell, all of a sudden you can't cook something that your family wants
Yep.
because you can't be in the house with that smell, so.
Exactly,
you know, I
exactly.
think that, making sure that people understand the level of help that's available.
Right.
You know, cause when I first was hearing about it, I was thinking, well, you know, what are they offering? It never occurred to me, like grocery pickup at the grocery store. and
Yep.
Things that would be real difficult for some people.
Right.
Who are dealing with cancer.
And especially in our rural area, And so we really haven't got the ride share, or the get to appointment situation. Vicky has been able to help a little bit with that if you qualify for her program. But there's a lot that didn't realize what program they have available for 60 and
Right,
older, I
yeah.
believe. So through the county, there's actually quite a bit. And so she actually was gonna try and be here, but she got called so she could go take someone to the post office, the grocery store, and I can't remember somewhere else, but anyway, but the point is that that's available through a program that's already existing, and that's another piece of ours, is to help share what information.
Connect those.
And that's important. I think that
Yeah,
if you reach out to the different insurance carriers in the area, like Partnership, for instance, they provide transportation.
Mhm.
And a lot of folks don't even know they've got that benefit.
yeah,
Yeah,
So knowing, hey, what insurance do you have? Because, or assisting them and saying, hey, do you provide transportation to and from your appointments?
Mhm.
Most of them do.
okay.
And most people don't even know of that benefit.
Partnership does have a.
They do.
And they also have.
Wow.
yeah.
Okay. Oh, did you?
Yeah.
Anytime in the area, should.
Hotels, they.
Yeah.
Food allowance,
All right.
that, if they're traveling.
So rather than paying for it, just having that information.
Yeah.
Agreed.
Who provides that through their policy?
Yeah, and to where we're not, some of it we're not providing, but that we can have on our website, have a
Information.
one location, so, cause then trying to get through an entire field of information where you're just talking about, I'm struggling with cancer, what do I need specifically for this?
Yeah, and that's more of an advocacy role,
Mhm.
but knowing we'll do that.
Right.
Yeah.
Because it's more pervasive than you actually know.
Yeah.
Partnership has their case managers.
Yeah, yeah.
Okay.
They help navigate the patients. We've had a few, which I was surprised at
Yeah.
how good they are.
Yeah.
Oh, that's
And you know,
fantastic to hear.
depending on the cancer diagnosis, each cancer has a community too, and that, those can be very helpful. So that's what we're trying to do is
Yep.
resource. You know, you have lymphoma, here's
Yep.
the lymphoma society, here's the number, let's reach out to them and.
Yep.
You know, so.
And then we started
We're hoping
hunting
to
for
really
the
grow.
grants as well, yeah,
Yeah,
because we know those are out there.
Fantastic.
Mhm.
and we're also looking for a board member, not that, anyone here.
I know, anyone. But if you find that you're, I mean, or just in the people that you interact with, so, cause like with Jessica, it was, very helpful because she had been through the process. So having someone that has that knowledge is helpful for all of us as a board. And so that's why Kate has been an amazing addition. So, because otherwise I'd be just like Googling it, and that's not helpful, you know, so.
Yeah, that's right.
We currently have 4 members of the board
We do. Mhm.
and
We're a 3 to 7
Okay.
on our bylaws, yeah. So because we knew we were at this beginning stage, so our bylaws are set to fit what our capacity actually, our limited capacity that we have.
are you at this point capable of taking any kind of stock or real estate? Are you at that point yet? As a donation, or is it just pretty
I'm
much?
sure Jessica can figure that one out.
Yeah, we would
She's good.
need to investigate that,
Mhm.
but I'm not gonna say no to anything.
Right, sure, it just takes, it's just.
Yeah. A little bit of education.
For you.
Mhm.
Yeah, it's education, that's it,
Mhm.
and there are so many resources that can help us with how to do that properly.
Yeah.
I was like, big brains are out there,
Yeah.
I'm an organizer, not a big brainer. I think there's last, and then besides our contact information is how we can help, and so I know we kind of just went over that. So, but our areas, which I think is part of what, was being asked to, is Westwood in Greenville. So not only the Lake Elmo, so we're calling it the Lake Elmo Basin. Even though Westwood has the opportunity with the Susanville organization, Susanville has a cancer, and interesting enough, they've reached out to us and offered to donate to our cancer to get us going. Cause they've actually supported quite a few, Lake Elmonor residents, that maybe have come through a banner. So I'm really excited about that partnership and relationship. They do a lot more, and we physically don't want to do the capacity of lots of events. That's not our goal. And also being chamber, I do focus on how can I help a business and help myself, or help this organization. So that's where the Dine and Donates are great, because I'll get to hang out there and eat all day. So it's such a fun. So anyway, so that is it, and then ta-da, and which is also on your pamphlet. So thank
Thank
you.
you.
Appreciate how much time you guys allowed us to have.
Thank
So I think I will reach out though regarding, which I know Kate knows a lot of it, but I did make myself a note, is basically screenings. I had a conversation with a family member that is concerned at the moment, and so of course I was like, well, have you got screened for cancer? And she's like, oh, I didn't think about that,
So it's really important to tie into
Yeah,
our colon screening,
yeah,
uh-huh,
our lung screening or our smoking cessation, those types of baselines.
Yeah.
That we can offer all of those
Mm-hmm.
baseline services for them,
and so who is that contact that we stay in contact with, who, Brady?
to bring
Okay.
the clinic.
Okay,
But yeah, I mean, they
Because
should
then
get a
we wanna
baseline
help.
colon screen, they should get a
Yeah.
baseline lung, they should get baseline breast.
Yeah, I would say Chelsea and I, because
Great.
a lot of our payers and our quality measures are
Mhm.
based on all of those.
Okay.
things.
Baseline on those things.
okay, and that would be huge. I mean, I know I got to do a walkthrough because I was with the other LACF and got to do the walkthrough of where the new mammogram trailer is gonna go with the new hospital and,
MRI.
or MRI, sorry, that's right.
Hopefully a fixed mammo would be better, obviously.
Okay, but so knowing that because I believe you guys had a mammogram bus or something
Yeah.
come at some point,
We're
no,
not gonna do that.
Okay,
We
all
used
right.
to, however, and it would come up here.
that's, okay,
And the only reason I say we're not gonna do that is because the technology in those buses is not
oh, okay.
standard of care anymore. It's all
Okay.
2D.
Okay,
service.
so that's understanding how can we help get that information out and
For sure.
remind people to go get checked, and we can help with that.
Yeah.
That information dissemination.
We're really trying to push, that pre-screening,
Mhm.
baseline, you're ahead of it, you have much better
Well, this
survivability.
time of year, as, we also go kind of into our shoulder season is where we're trying to encourage people to come in and get screened.
Right, right,
Yeah, we do a lot of messaging around
Okay.
this
We do.
season.
Right.
You
right.
guys did a really good job. This is way too personal, but I had my colonoscopy done here. I was so pleasantly surprised. I had a physician down in Chico Forever, and I was always going down there, and I thought, what the heck was I doing?
Like
Driving all that
Christmas
way.
Day.
Yeah, it was really nice. Yeah, very well done, so.
Yeah.
Yeah,
The team does a good job.
but no
Yeah.
mammogram.
Not yet.
Okay,
Once
but with the
again.
new build, you'll have it.
No, no.
Okay.
I would like to get a grant.
Okay.
I'd love to get a grant for 3D tomosynthesis.
Yeah, yeah,
There's a lot more to mammography than just the device.
right,
It's a
yeah,
whole program.
right.
But we do have a mammographer here. She's a qualified mammographer,
Okay.
so
So colonoscopies though?
colonoscopy, lung screen, we can do CT, we can do low dose lung screening.
So you do
Yeah.
CT?
Low dose CT lung screen.
Okay. And is that recommended after 50 with a history of smoking?
Any smoking cessation.
Yeah,
Absolutely.
it's below, yeah.
Okay,
And you can ask the specific questions to the med staff too.
sure, yeah, yeah,
Great.
perfect.
Yeah.
And that also might help with your guys' messaging is promoting that the yearly checkups, the yearly physicals, because what it does is it gives a
Right,
baseline.
yeah,
So if people are getting the yearly checkups and physicals, when they have a baseline for the doctor to go at, so they know, oh, look, their white blood count
Right.
normally lands in this range, or, oh, this is way higher than it normally lands. So if we don't have that baseline, it is harder to diagnose stuff.
Sure.
So that's something we've been pushing with a lot of patients is
Baseline.
that baseline is
Yeah.
important, and so explaining that to them, I think helps, especially
Mhm.
when people are concerned about potential cancer screenings and things like that.
and then that physician or that provider could suggest which screens are appropriate for that particular patient. Perfect.
And mouth cancer, gum cancer, there's a lot of
Mhm.
throat cancer
Yeah.
around here. A lot of people
Mhm.
like smoke this tobacco. Might want to connect with the dentists and
Okay.
just say, tell them who you are.
Yes,
That way they have a case they can refer. and-
And then.
No, I appreciate that. That's actually-
Like with our patient resource page, we link to like a local dentist and different places
Mhm.
like that.
What you guys-
So what we can do is we can create a section for you guys and.
Oh, that's amazing.
yeah, thank you.
Yeah, thank you. Wonderful.
You're good.
Any other
Sure.
questions? Because you guys, that was great that you guys asked questions. Yeah.
It mentions on the back brochure, donated time, what capacity is that available to?
I think the goal for that was gonna be for meal delivery as well as, any travel needs that people, so like the gentleman I was talking to actually has eye cancer. And so it's a possible need to actually get him from point A to point B. So it would be drivers.
And
Yeah,
also going into respite care because
Mm,
oncology treatments can be very taxing on the caregiver too. So providing people with a break every so often
Mhm.
would be lovely too. So but that'll be in the future.
yeah, because we don't have any in that need at the moment, but. Yeah, wonderful. Thank you. Great question. Thank you. Appreciate that. Okay.
Thank you.
Thank you.
Thank you. Appreciate it, guys. We're gonna get out of here. Yeah. I don't see it. Talk about it. No, I actually. We have great water. What's your beer?
Okay. So with that, I think that brings us to item number, item number 6. Approval of the September 25th, 2025 regular board meeting minutes. Okay. You have a chance to review and comment. Motion to approve.
Move approval.
Thank you. Do I have a second?
I wasn't here.
Oh, yeah, no, you weren't. Rich, do I have a second?
Second,
Thank you. All in favor? Rich?
aye.
Terry?
Aye.
And I will vote aye. And has Ken joined us online yet, by chance?
Nope, not yet.
Not yet, okay, thank you. All right, that brings us to item number 7, staff reports. First up.
Hey, I did a written report. If there's any questions, we can just go over. I just wanted to give you an idea of where everything stood from a legislative perspective as the season closed out, as the legislative sessions closed out. What things passed, what things were put aside, and this is just a snapshot. You can ask me any questions you want, but it was because of the budget and a lot of other things that were going on. There was a stay on a lot of things that could have really whacked us. They went into a 2-year. I can tell you that I've looked at the calendar, the leg calendar for this coming session. It's gonna be a really busy healthcare year. It's just, there's just a ton, I mean, it's unbelievable amount of union supported legislation that is really impacting healthcare coming forward again this year. So it's gonna be a really big legislative year. We're gonna have to really watch what's going on, but I just want to give you a snapshot, and you can take a look at it and as you want. Some good stuff. HR1. So we're still trying to, everyone is still trying to model HR1. I can tell you that the government shutdown has put a kibosh on any reconciliation coming forward. I mean, if the government shutdown, it's really, you can't tell which way it's gonna sway, either way.
My travel through TSA was a little more pleasant.
I actually have had very good, I traveled too, and it was actually really easy. Keep it closed, no. I think the thing though, if you notice what's holding up the government on the government shutdown is the ACA, Obamacare, potentially rising premiums and things to that effect. So healthcare is on the forefront of everybody's mind in Washington. I think when they get back from the government shutdown, which hopefully is going to end here soon, the HR1 will be taken up immediately. Reconciliation will be submitted. What's
I
that?
thought I'd be open earlier this week.
Yeah, it doesn't look like it.
Surprised it isn't yet.
They're saying next Tuesday. I heard that today from some, I don't know why. What's next Tuesday?
Election.
Election. That's right. That's right.
Election day.
Election day. So thank you, Rich, for reminding me to vote. Very good. So HR1, I think is gonna start getting some steam going through it, and through the first year, we'll continue to model it, but nobody's really on top of it. Yeah, a lot of guessing going on. Support services building, we have had a donor that has come forward. This is the metal support services building. A donor has come forward, and I don't wanna dig in this too much, but this donor is rallying a number of contractors to bring this building to bear, going through the foundation. So this is a donor that's kind of taken the ball, and through their own donation and through their time and through a sort of a team effort, local contractors trying to bring a consortium of local contractors together to bring this thing to bear. We have been talking about this in the foundation board meeting. This donor has really taken the ball on this thing and running with it. So it looks as though the support services building will more than likely be funded through a donation to the foundation, which is gonna be amazing.
Fantastic.
It's fantastic, right?
It's not officially approved.
What's that?
It's not officially approved.
It's not officially approved. I just wanna say that it's out there.
It's on
What?
the horizon.
Yeah, let's not erase the fact that we still have to put a building up. But we're hoping that that is not gonna be a big impact to the district itself. So in that note, let's,
And just going like this, let it happen.
yeah. This one's, it doesn't have a lot of flakiness to it. It feels pretty good. So it's starting to move along quite well. On the second floor, tenant improvements, we had talked about that second floor boneyard for 5 years since I got here.
Yeah.
I think that, we need to consider, the board needs to consider, this probably become later. Will be the fact that we've got 2 capital projects that are being pushed out. One is the support services building, which we believe and we'll know more about within the next month, whether or not it's gonna come forward. That was a considerable capital improvement. The other one is the MRI, the $400,000 that we are going to have to put forth as 1/5 of our MRI purchase. Is probably gonna be in the 26-27 budget cycle. So we don't have a capital outlay
Yeah.
yet for this year or this coming fiscal year. So what I would like to do, and I want to rub some edges off of this, is I'd like to consider the build out of the second floor, raising business up to the second floor, and that opens up the entire lower half of the clinic for additional clinical activities, which is really what it's built for. We are going to go to bid on this, so we have an understanding of how much it is. Our architects have given us a number, but we want to confirm that. We want local workers to do it. It's an infill, it's TIs. So I just want to let the board know that our because of these push off on some of these capitals expenses, we are kind of focusing our attention back up to the second floor. And it may be coming to you shortly with, or the next couple of months with a proposal.
Does HPI have to be involved for the clinic?
No, it's literally just a county. So no HCI. And we'll be, like I said, we'll be coming forward with that. We would like to also, at the same time that we come forward, give you an idea of what we're thinking about for the lower half of the
Hey,
building.
we can have that.
Yeah,
in
yeah.
tandem, that would-
Yeah, I mean, I don't want to ask for approval because we're not quite sure what we're gonna do with the downstairs, but there's plenty of clinical departments that are in the periphery, they're sitting out in different buildings that would be good to bring into the clinic. We can think of a few, but we want to be able to provide you a whole plan.
And then we'd be decommissioning those outbuildings
Correct.
and
Or
that we need
Or
to.
repurpose.
or
repurposing them or,
but
yeah,
we
we've got
can
several of
take
those
this
things. Yeah.
from-
So part of the strategic planning, part of the campus planning on, so now we're starting to focus on moving pieces around this campus. And we had a very interesting conversation and we'll talk about it later, but very interesting conversation about the old facility. So I want to be able to share that. Just know that the executive team and some others have been talking about the existing campus, and we'll be bringing it to the board in the next few months to have dialogue around that. But it's part of the discussion campus-wide. AI digital assistant. So man, we are inundated, absolutely inundated by every company that,
I'm getting them too.
oh my goodness, they're out there. And we've seen a couple, we've set a couple of meetings, are very impressive. Some of the executive staff, when I was out being a grandpa last week,
Are they actually plugged in and showing you, or are they just showing you a presentation of what it's supposed to look?
oh no, it's always a presentation, which makes it perfect. But
Yeah.
apparently there are a couple of the other hospitals, and I'll let you jump in here, Brady and Judy, that are using AI, including PDH and EPHC, that are using AI right now, and you want to share what their thoughts
I
are?
mean, so in that meeting, Judy and I were there and just.
Quarterly CEO meeting.
Yeah, talking about the AI applications, and it's crawling in everywhere, but the biggest thing is the interface between or with the providers. Even providers that they don't like technology, they love this thing. I've had providers that have known for years in casual friend conversation going, hey, if you guys start using this, which it kind of floors me because they are anti-technology, especially we've been around long enough when we had to implement the first systems. And it was, those were hard discussions on the why. So finally, maybe joy's coming back to medicine for the providers, so.
But what are they using, what are they using it for?
They're using it to interface like in a clinical application when they're in a room with the
Verbal
patient,
Oh.
you know, so they hear it, they do the notes, they go in.
How is that different from Dragon?
Yeah, just.
No, Dragon is something they have to dictate into.
Yeah.
This is, they turn it on. They just turn it on and they're having a conversation with you in the
With Alexa.
room. And it picks up, because, so in the demo that we did, I tried to throw this thing off, boy, I gave it every weird. I tried to throw it off, and what it did was it captures the medically relevant things in our conversation, so physicians, instead of sitting on the computer, can have a conversation with you, and it literally is grabbing everything and only keeps and distills down what is medically relevant, and it actually puts it in a draft note. And then the clinician can go through and adjust the note. Some of them actually, based on the note, it'll generate orders, say, well, let's go ahead and get that chest X-ray. And we're gonna have some lab work. It'll generate the orders. And it will also generate the appropriate coding,
Wow. ChatGPT.
all right there in
Kinda
front of
gets
you.
scary.
It's really stuff, because you can try to throw it off. You can talk about anything, and I did. I talked about Shinuki becoming a professional soccer player. And you know, I was playing goalie and I was drinking too much bourbon, and I think I tore my whatever. And it picked up everything that I'm drinking too much bourbon and I tore my this. But so the note was, talk to this person about not working anymore. Anyway, get into a yoga class, whatever, but it was pretty impressive. Here's the deal though, and I think Rich is on, and Rich will probably align with this. I've seen this before with big technology shifting going on, that you have all these companies that are in the race. I think what we're gonna see right after the first year is gonna be big M&A. You're gonna see so much acquisition because some of these little companies are coming up with these really kind of unique little pieces of this. And you're gonna start seeing the larger companies just start to buy them off and get rid of them and start to consolidate this. One of the areas, other than the physician's interaction with it, that was really impressive was all of our AI developed pre-calling.
Yeah.
It sits there, looks at the calendar, it pre-calls. It's literally talking to a person. You can ask it a question, it understands the question. It'll ask questions like, do you have any problems with transportation?
Question on that one.
Yeah,
Is it identifying itself as being?
you have to.
Okay.
Yeah. You do, there's some law in California that if you're gonna use a digital assistant in the physician's office, they have to opt in. And it's not like everyone's opted in, you have to opt out, they have to opt in. And so there's some work around it. But as it relates to them just calling out for our scheduled appointments and things to that effect, no. It sends out reminders and it talks to you, and if you have a problem, it can actually reschedule you. If you say, I can't make it that day, can we find another scheduled appointment? It will schedule for you. So that's, to me, is fascinating.
That is
And-
fascinating.
What's that? Well, that is the big question for every one of these companies is, what is your integration level with Cerner?
Yes, Cerner has their platform.
They have their own.
And the different CEOs, one or two of them went with the Cerner platform and one went with another
A
platform.
third party.
Yeah, so
So what KDH and EPHC, what are they using?
Cerner is at PDH and there's
No, I mean, I'm sorry, the
Lem-
AI.
For the AI and
Yeah.
for the providers, Eastern Columbus is using this Cerner.
Digital agent.
Their providers, even those, I mean, they've had an even more tremendously negative experience with Cerner than we have. But it's working really well, and some providers that they never thought would adopt this are loving it. And they're getting home much sooner at the end of the day, and, so that was a great testimony.
And the note is really comprehensive. It really captures a lot. So the note is, when you read the note, it's very, very detailed and comprehensive around what your visit looked like. So I think that's future. I do want to see how the M&A goes. I think there's gonna be a lot of it.
So if Cerner has their own component to it, do we know how much it is to add that? If
We have the
wanted,
numbers.
Or would
We
we
were
try
given-
it before?
We were
buy
given a quote. Yeah, try.
Yeah,
I love that.
Yeah,
Optimistic.
their model is more of you pay as you go kind of thing, so
Yeah.
they give you so many notes and stuff like that. But that's the first one. Ethan and I and several others had them talk about how their model is, but it's changing so fast. I mean, it's coming quickly. That's why pausing, doing our research, if whatever agent we decide to do, because it's from registration to revenue cycle. I mean, it's
They do rev
all
cycle.
over the place. And then put in whatever we choose to put in the next budget cycle. Because the technology is
Will be
impressive.
completely different by then.
Yeah,
Well, it
Yeah.
will be, give it another 6 months and this technology is moving so fast. The rev cycle is really interesting because all of the insurance companies are using AI to deny.
Oh, great.
So we're starting to use, now we're starting to use AI to make sure it buttons itself up tight enough
Yeah.
for. So it's the battle of the AI bots in the world. And I think that we just have to pay attention to the market. It is super dynamic market right now. I think that HIMSS, I don't know if you're going to HIMSS, Rich, I think HIMSS might be something worthwhile this year. Because instead of all electronic health record, it's all this AI. That's everything from registration. And another thing is when it calls, it confirms all of the information that we need to confirm.
Mm.
It talks about
Your
change of
insurance
address, your phone numbers, your insurance. And because the AI has the ability to look up, like the insurance, it can actually look it up. And it's just, so when they come in, everything's updated and ready to go. Everything's rock and roll. So really.
John, do you plan to go to him?
I think I'm gonna ask the board to go to HIMSS this year. I think that it's not about EHRs anymore. I really think it's about AI. And I think it's an interesting year to go.
well,
Okay, because, AMDIS is a partner with him.
Yeah,
And
Well, I think-
we do the pre-conference, and if you want to go to that, I can get you into that. No cost.
let's talk about that, Rich. It's this spring and I think that, we should have a contingent that goes. It's in March.
Yeah.
And,
I have a meeting with him next Wednesday. So
and where's it being held this year? Do you know? Vegas?
Las Vegas.
Yeah, it's Vegas.
That's
So
about it.
I would really
Oh.
I think that Seneca should have a contingent that goes there and really focuses on those front office, and some of the revenue cycle AI that's starting to develop. I think if we don't want to get too far behind the curve.
yeah, the other thing that's happening in some of what the legislation, like the rural, $50 billion.
Yeah, technology.
Yeah, technology, it's almost like, when we started with EHRs and stuff, there's a technology, for grants and stuff like that.
Oh.
Because they're still seeing inefficiencies of, healthcare.
Mhm.
And so with all these new technologies, there's another push coming from that, from the legislation side.
It's fascinating.
They are getting money back to do it.
What's that?
I said if they get the money to actually do it.
Yeah, I mean, it's more stuff. But you're gonna have to augment, it's an augmentation though, right, so, okay. Cool. That's my report.
Any other questions for Sean? Rich, is there anything you wanted to add about the AI discussion?
No, other than, let's watch it for a while. Let's not,
Yeah.
yeah. I'm interested in what's happening in Plumas County, but what's happening all over the country is of interest too. Including some of the big players aren't just the vendors. It's the systems like Cleveland Clinic and so forth that are offering it to the smaller critical access partners. I'm interested in seeing what they're doing.
Interesting,
Okay.
very interesting, Rich, thank you. All right, I think, Judy, that brings us to your report.
Okay, my report is pretty straightforward, so I won't read it to you. I just have a couple things to add, the lab grant that Elsa and I am working on. We were hoping to hear by November first. And that's just a couple days away, so fingers crossed that we get some good news. To recoup some of the expense of adding that new additional equipment. Our QIP grant, we just received one on Tuesday. Heather Hemping is our leader on that project, and she went through an audit all summer long on our QIP, which is our two population health, colorectal screening, depression screening. It was an excellent audit. She did a wonderful job, and got word that we will receive 100% of whatever is available.
That's
For us, which is usually a significant chunk of change for us.
Yeah.
That was really great news and a big relief to Heather as well. She worked very hard on that.
Congratulations, sir.
Yeah, thank you. And with that, unless you have any questions on my report.
I was just curious, how many trainings we're hoping to have for our CNA program?
We are accepting 4 and 6.
Are certain good applications?
Yes, we are.
Great.
So that's exciting. When Brady and I went to MoDOT for the CEO meetings last week, and they gave a tour of their SNF and it was lovely. They really did a wonderful job. And one of the things that they added in that space was actually a CNA training classroom.
Oh, nice.
Which I was kind of relieved, because we don't want to all be competing for the same CNA.
Yes.
Because that's where we're gonna
Have
be
they
with
done?
the PDH opening and their opening, and I was surprised to learn that MoDOC isn't just moving their 50 residents to the new facility. They grandfathered in 34 of their old beds, so they'll be running 2 facilities, and so they'll have 84 residents, which will take a lot of LVNs and CNAs.
Yeah,
So,
sure.
and then with PDH opening, they will have a total of 36 residents, so it's something that we have to pay really close attention to. So I would love for us to consider all of the things that we're doing with our existing campus, that we pay close attention to our educational needs and training that we need to do on campus as well. So anyway,
That's good, yeah. Has MoDOT, have they done any CNA programs yet?
I don't know that they've done any yet. I don't know if they were doing them for their previous facility. But the classroom was really nice. They even had a bathroom and shower that was set up so that they could practice their transfers, and things like that. And really, thoughtful way to set up the classroom. So classroom plus actual clinical areas where they can simulate different activities, which I thought was very
Really
smart.
nice, yeah.
Yeah, that was beautiful.
Forward thinking.
I don't know why the land must be cheaper. I don't know. It seemed like what they quoted as their cost per square foot was about $400 a square foot less than we're paying. I mean, everything, and it's beautiful. They just did a wonderful job. We still have our Elverton students on site, and they're doing really well. Sean got his flu shot today from one of them.
We're still standing, so how many?
He was awesome.
We currently have 4 students from Feather River, and then we will have 2 more joining us from a program out of Reading.
Are any interested in coming on board after?
So the 2 that are coming from the Reading program are definitely very interested in joining us, and so we made the accommodations for them. One, we could only accommodate on night shift, and she was like, I'll take night shift.
Okay.
So, yeah, great, yeah, so it's been really, it's been good, and I think our staff are really rising to the occasion. That's all I have.
Thank you. Any other questions for Judy?
Thank you.
Thank you, Judy. All right, Brady, that brings us to you.
Yeah, so it's kind of the standard report, some of the highlights, clinic wise, we just did, pretty interview. Winter months or the winter model. This is the time we bring on new people into healthcare and get them excited, and then they potentially can launch into other positions. So, we've had some great interviews today, and so more to come on that. And then when it comes to Linda's report, that we did our active, shooter, full scale, kind of, exercise, and I wasn't here for that, but, I know Judy was, if you would like to add anything to that.
Yeah, we learned a lot of very valuable lessons. Linda and I had other meetings with some county, public health people, about an hour ago, actually. And because they wanted to learn, you know, how it went on our side. And we'll have the full after action review on November 13th at CPUD. But, the things that we are working on that we knew we were gonna identify gaps was patient tracking through the system from the time they hit our campus through family reunification. And we unfortunately only received 2 patients for the first hour and a half or so. And then we got this bolus of victims right at the very end before they called it quits. And, so, but we still learned a lot when, and so we, have formed a couple of subgroups to work on patient tracking downtime forms, and ER physicians and staff. And, we're putting together disaster parts, that, because we were sending our maintenance guys running for, I mean, they were like, and get me this, get me that, and it should all be, you know, together. And so the things that we're working on post the exercise, it was good. I think our staff really enjoyed learning how to run a disaster.
Now, is the county gonna repeat it after everyone goes through their lessons learned, have they said?
So, what they want to do is that they have not been, very inclusive of the hospitals in the county in a lot of the, drills that they've held. And they really are seeing the value in including the hospitals as
They should be.
a
I mean,
necessary component,
yeah.
especially in this type of exercise where you are gonna have a lot of medical needs. And, so even though things didn't go, exactly how they wished they had gone according to the way they planned it, we just, well, Linda and I love this kind of stuff anyway. So, you know, we just reiterated how important it is that they include the hospitals always in these instances.
Did they have social workers there at all?
No.
I think that's the.
Oh my gosh.
Well, there were several things that,
Angry parents.
I mean, that's, but that was interesting.
Yeah, Chelsea Greg is our social.
That's so basic.
have our, when we have our full scale debrief with the county, we're gonna be talking about resources that need to be at these types of things, zero participation there, and just some breakdown and some communications and just getting to understand what they are doing, and what we're doing, because there was literally, we were just in the dark the whole time.
Yeah.
Just had to make, so there's some really good lessons learned countywide, believe me.
Good, and, but a lot of the communication failures weren't really real. And we talked about that earlier today, that it was a communication failure for the exercise. We know in real life, we would have people swarming us with
Oh,
information, right? You
You
know,
hope.
I know, I mean, you know, so we know that it wasn't realistic per se, for at least for Chester, that we would have had a lot more information at our fingertips in a real disaster, because my God, word drop stuff.
Yeah. That's the end of it. All right, thank you.
Brady had to step out.
Should
to
we
manage
should we
something.
wait for him and we'll?
You can, unless you just want to, if there's any questions, I may be able to answer them, but, did a pretty good job of putting things together and report.
Yeah, we'll, if when he comes back, we'll see if he wants to highlight anything else,
Okay.
if that's okay if you wanna.
Yeah, okay.
Thank
So,
you.
I'll just go over some changes that have happened since I submitted the report. Things always happen. So our medical staff coordinator, she will be starting on Monday, so we're excited to get that training going. Our physical therapist, we have one candidate coming on Monday, to check out the facility in the community. The second one has gotten back to me and she's still undecided if she wants to come on site and, will get back to us if she changes her mind. CNAs, we have 7 that have applied and one today that interviewed for the clinic wants to do, for a per diem job, wants to do both. She was amazing, so let's hope that works out for her over there too. For CBA renewal, we have gone over all of the non-economic changes with the union, just working on the edits and hopefully can get some tentative agreements at our next meeting. Then probably the worst is Dr. Greg is no longer coming on board with us. So we have to, start our physician recruitment efforts, again. So
Did he give us a reason?
he had some personal issues that came up that he has to handle, so it just kind of changed his decision making. Any questions?
Any questions for him? Thank you. All right, Chelsea, you're up, or Chelsea, sorry, I was here earlier, in my brain. Chelsea. I am gonna highlight something on Brady's report only because we talked about it, because he was all excited about it. So he added the monthly clinic volume trends into his report this month. Yeah, I can remember. Okay, so, go down one more, Ethan. One more, sorry, I don't know where in his report is, right there. So we actually sat down and looked at these, at the end of last year, and then that was how we kind of planned like different marketing strategies for this year. So, like, for example, we looked at, you know, so for July and August is when we started pushing the come for your yearly physicals or your annual checkups, your, you know, all those things. So trying to push, already knowing that September drops in levels and things like that. So that was one of the things that Brady and I had talked about that he'd asked me to highlight on this with him. So I did want to make sure that gets highlighted before we move on.
It might have been interesting to see the previous, year over year,
Right.
you know.
And I don't know if that
We
data,
start to
because
see a
this is
dip.
from Cerner, so I don't know if that data
Okay.
is easy
sits in the
to,
other-
yeah,
Yeah.
well, it is on here, 24 versus 25. Right, that's the dark blue versus the light blue.
24. Oh, gotcha.
Yeah. Right. So,
But I mean November, like no.
well, we haven't hit November. We're
oh,
November,
gotcha,
December, we
gotcha.
got those numbers yet,
Gotcha.
so. But yeah,
Gotcha.
so the light blue is this year, the
Gotcha.
dark blue was last year, so it kind of just gives
Okay.
you guys an idea of where we're running, but then what we're using is we're using this analysis to help us predict when we need to try and push, you know, different messages and push things like the flu shot, the primary care visits, things that maybe aren't as, you know, as a walk-in clinic visit, because obviously our, you know, June, July, August, they're busy. They're, you know, not the times that we really need to push those things, so.
And dovetailing back to the cancer foundation too, or, yeah, you can play in those wellness screenings with that component as well.
Right,
sure.
and that's why I brought that up too, because that is one of the things, even this week, I dealt with a patient that had a complaint about, we didn't identify something in the blood work, but that was the first time they'd ever done blood work with us, but their doctor down at, UCSF was able to identify it because they had prior history, so they were able to identify that, oh, that is, so even though it was in normal levels, it wasn't normal for them. So that is one of the things we are working on, that messaging with patients and trying to really push the importance of that primary care and that established levels, because you don't come in for your yearly physicals, we don't know, you know, what's your normal. Hi. All right, we can get back to marketing. Sorry, I just didn't want that to get missed. Okay, so lots of things going on. So we're pushing, the BioBeam is huge right now. We're pushing that a lot. We do have our next information station is scheduled for November 7th at Blue Ox Coffee. So that is following a live, radio, alive at 7 in the morning. At the radio station, then, we'll stop at Blue Ox on the way back and have, coffee and just be there to answer questions and let, be available for anybody that wants to talk to us. So regular content is compiled for the Lake Elmer Country Club newsletter, so that's one of the printed newsletters. We've also started adding more information into the mountain, Intermountain News, which is the one that's printed out of Bernie, but it's available weekly and holiday. So we've started adding more information into that and trying to just hit those different demographics with that stuff. So several press releases went out, some are scheduled to go out, so those are all in there. They were attached at the back, if you guys got a chance to see those. If not, they're all on our website. And any questions about any of that? Okay, other than that, we have lots of website updates that took place. We had a lot of HCI updates. We updated everything so that we're in compliance for HCI, but now that we've had to add all of the stuff to the financial assistance pages, they're a little clunky. So now we're working through keeping them in compliance, but making them a little more user friendly. We just added them right now to make sure everything's there and that we're compliant. And then we're gonna, go through and try and fine tune it a little bit more and make it a little more user friendly.
What types of things did we have to add?
Really, a lot of it is just language, and then we had to add, so we have to have like the statement on every page that says help paying your bill, but then we have to have a financial assistance button on each page, and we have to have this type of button, and we have to have this, so we literally added everything, and sometimes it's the same button, like we have 4 buttons on one page that go to the same spot, but they have to be labeled 4 different ways.
You have to accommodate different languages
Yes,
too.
well, yes, so we have, we have the translation page, which accommodates the different languages, but then we have like, it's 4 different ways of saying help paying your bill. But it's part of their, it has to be according to their language, it has to be on there in all those ways. So we just added everything, so that way it's basically like it's foolproof, but by the time we were done adding all the things that they want, then it's like, oh, it's a little clunky, so now we're gonna still keep all that content, but we're gonna work on
Rearranging it.
yeah, rearranging it and making sure it's easy to consume and actually use, because it's a little, clunky right now. But it's compliant, so,
That's important.
yeah, so, and then we started coding pages for Lake Elmer Lifeline. So Lake Elmer Lifeline is something that we came up with from different feedback from this board and the foundation board, taking the information of trying to reach the different demographics. So what it actually is it'll be available on the website. It'll go out by email, but also it gets printed and it gets put in the local coffee stations. And it is all the content that we already put out, but we're putting it into a printed format that we can then give out to people that want it printed. So we just put the first one out this week, and the first day at the coffee station, we just started with 30 copies. They were all gone. So
I love that.
Brenda said people loved it. They were,
Educational.
yeah. And it's.
Are you including holiday too?
So I asked Emily, we're gonna talk about a spot to maybe put it.
They
Um,
don't have their board anymore.
they don't really have a place, but we are gonna try like, Blue Ox, Conan Craig, the post office, places like that with it. And it's so easy. It was 2 pieces of paper that we just put out, and it already has, we're not creating new content. It's content we're already making
Right.
and putting out. We're just putting it into another format to try and get it out to those people that don't use the internet. They're not on Facebook, all of that. So, and it's content that is about the district, the foundation, hospital, any of that stuff. And even, like this one even had, we're gonna be closed for Thanksgiving and the day after, just so you know. So, and that's,
great. That's really.
yeah, so that's what that is. And so hopefully we can try and, just hit another pocket of those people that we don't necessarily hit with all the digital things. Merchants Trick or Treat, so we are participating in Merchants Trick or Treat. The map has gone out of the different locations, so we put that out every year, so the clinic gives out candy, the hospital registration gives out candy, and our skilled nursing, and then the foundation will give out candy. We also have Brady will be at the high school with the Seneca van. We're gonna decorate that tomorrow evening for him, and he's gonna participate in their trunk or treat at the school tomorrow night. So, yeah, we're trying to stay involved in those community events and, you know, give back there wherever we can. Christmas party is coming up December 12th. And then in the foundation report is the, Toast to Giving event, which is November 12th. So the 12th of November and the 12th of December are both dates, or events that you guys are gonna wanna put on your calendars. And then other than that, it's just updates on the different campaigns. We're continuing all of our regular campaigns. We have reduced the geofencing this time of year because we're not seeing a ton of tourists and things like that. We are pushing out provider recruitment. We did cut back the PT position, like marketing stuff that we were doing on our end, just while we have applicants, and then depending on what happens with these prospective PTs, we'll either ramp it up again or we'll, you know, take it away. And then continuing new build efforts and, you know, coordinating with Judy and Linda on signage and all of that stuff and finishes and then working on the partnership QIP survey. We have been getting, responses back. We're, over 100 and something responses. We did because people asked us to add an open-ended question to where people could give us feedback. So I am compiling the different feedback as it comes in, because some people are literally giving us feedback like, I need a referral right now with their phone number. So we're trying to keep up with that and just send those to the departments that need to know. But at the end of this, we will, compile that feedback and give that to the different departments and share it with everybody.
Was there a threshold?
We have to hit 200, but we have until the end of December. And then we have to submit our results in January, and this is part of the quality improvement program. So, it doesn't matter whether they're a partnership patient or not, the survey has to be available to everybody that comes in, and it has to be available in multiple formats.
Right.
So we have it available in paper format and online, all of that. But the open-ended question we added because last time everybody requested that we add open feedback. And so we'll share that with management and leadership after that all comes in.
Okay.
Any questions?
I'm excited about the MRI.
Right, yes, yeah.
We have 8 today?
It was yesterday.
Yeah, yesterday we had
Yeah,
8.
so every day or every week that we've had it here, you know, we started out slow and we've learned some things along the way. But it is getting better and better as we go.
Good.
That's it. You wanna do your foundation update? Do you want me to, or do you wanna pop back to Brady?
We can pop after Brady after she does the
Okay.
foundation, if that's okay.
Okay. So our Q3 donation letter went out. It's, we're continuing to get checks and donations from that. Budget for the foundation is well in works for next year. We're trying to keep a pretty lean budget so that, you know, we can give the most that we can back to the district. There's estimated expenses. So this top section, like I explained last time, I kind of summarized everything in the top for you guys. That's kind of overarching. And then if you need more details, it's down below. We are still continuing by being where, you know, we were at 30 the other day. I think we're at about 35 now that have bought beans. So people really like it. They say it's a great program.
It's very clever too.
Yeah.
And you guys did a great job with it.
Yeah, and everybody, and it's a nice experience for people. So, and the tours, I think, actually help too, because people don't even realize everything that's going on and all that goes into it. And so, and then it gives them a chance to, sometimes the whole executive team is there, sometimes it's 1 or 2, sometimes it's just Brandy and I, just kind of, we tailor it to the donor, and it gives people a chance to interact with everybody, so. It's a good thing. Golf tournament is set for next year for May 29th, mark your calendars. Our committee will be meeting to talk about a fall fly-in, potentially as a foundation event, and then our Toast to Giving is November 12th. Other than that, if you guys have any questions about the foundation, Sean, did touch on that we are working, with a donor for, coming up with a possible solution for the support services building. It is not, fully approved through the foundation board, but once that is, then I was gonna submit a report to all of you guys about what exactly the plan is and how we're gonna do it. There's a lot of details with it right now. We're working with a donor, with a lot of potential contractors in the area, also working with the county, and then, trying to get everything together that we would need to be able to make this possible and get an idea of the, potential cost if we do it this way. So,
Do we think we'll have that for our next meeting?
oh yeah, because we, potentially want to submit a request for a permit before the end of the year, so we should hopefully have that all together by the next meeting, because we should be. So that's the plan, we are working on that, and we'll keep you guys updated as we find out more. At this point, I just don't have solid information to share with you.
The event you're talking about, like the fly-in, for example, is that gonna be combined with one of the other events, or are you?
No, so
Separate?
our board looked at it this year, and we didn't feel like we had enough time to pull it off.
No time this year.
But the discussion was that not only could it be a great event in our area, but it could be a good fundraiser, and it also could connect our foundation with a different group that we're not necessarily connecting with the golf tournament, with our everyday events. So it's just something different, and it's a potential, like, another, like, fundraiser. We don't wanna do too many events with the foundation, but I think 2 a year, like 2 large events a year is doable. And that might also double as our, our member, like, like a donor appreciation, like.
Here's partly why I'm asking.
Yeah.
Because, I know the Chief Gray needs funds. And so I was kind of wondering whether there might be an opportunity, not for the foundation to plan that component of it, but there could be some sort of a joint event, where maybe the fly-in comes and we have all that, and then maybe they relocate to another location for some other event when everybody's already here.
Yeah.
I was just something that I was wondering if you might wanna consider trying to see.
I think that's a great idea, and I think we definitely can try and consider that. Chief Gray did present to our foundation board 2 months ago, I believe. And, so we are aware, and our foundation board, we are definitely working with him as far as like on trying to help facilitate where we can with like, oh, this might be a good route, or this might be a good,
So the fire sirens could probably handle that component of it.
right,
But if it was jointly done, we'd have all the people here already for
right.
whatever that.
I
is.
think that could definitely work, and then it's supporting both, entities and groups. I think it's something that we're looking into, because an event like that is big, and it does take a lot of, coordination to pull that off.
Yeah, I could just think, from the fire side, perhaps having CAL FIRE be part of that fly-in and start showing all their really cool stuff. And that could be a portion that can go to the fire department and stuff.
Right.
Because, they have a lot of air assets.
Right. I think there's options there, and I think that, the point of this, it's not necessarily like about donations, at least not at first. It's about building those relationships. It's awareness and building the relationships, and that's really what we wanna do, is we wanna connect with those people so that when they get our mailer that says, donate to this, they're like, oh yeah, I met Sean, I met Chalta, I met these people, I know who that is, I know what they're doing. So I do think that there is opportunity to let other people, collaborate with us on events. I think the more we collaborate, the better we are in this community trying to accomplish our goals.
Sure.
Thank you.
Got a question?
Go ahead,
How
Rich.
how much revenue did we bring in 2025?
How much what?
Dollars.
Oh, well, I don't have final numbers for 2025 yet.
Okay, I'm looking at the $91,000, the expense for 2025.
Right,
So
so,
is there income for 2025?
yes, there is. So Rich, if you go down to the Q3 report,
which was attached.
I have the attachments, okay.
Okay, let me pull that up. It should be, go down, it's, the first one has to green.
I'm looking under financial updates on Q3.
Yeah, so we have, so this Q3, so they're a little complicated because part of it shows, you know, expenses paid by the foundations and one paid from our initial startup loan from SHD. And so in the bottom line, it shows total expenses. That is including golf tournament, all of that, and then it shows change in net assets and revenue. And so you can see there that we're at probably over 150,000 for this year. As of the end of the third quarter.
150,000 is the amount of money that we brought in this year without considering
have
a
left
loan here.
Yes. That's what we have, yeah, that's what we have left over. That's after like expenses and things like that.
Okay, I guess I'm trying to understand how much, forgetting about the loan, putting aside the loan.
We have over 250,000 in the foundation assets right now.
Okay,
That are, you know, those are the funds that we're looking at for how we're going to distribute them back to the district, whether that's through supporting the support services building or through, you know, other parts of the project. There are small parts of that they are designated. So there are, you know, for example, we have $450 that is designated to be used for the helicopter landing site. So we have to use that in some capacity towards something on the helicopter landing site. So we do have a few donations that are designated like that, and restricted, but the majority of them are not.
so the decision about how to spend the unrestricted funds is for the board of the foundation to decide?
So, yes, so the board of the foundation, so what we're coming up with is what we need for the potential operating budget for next year. To be able to, you know, carry us through the year. So, and our goal is to keep our operating budget, you know, we'd like to keep it under 10% of what we're bringing in. You know, and obviously we have to build up to that. But what we're trying to decide is how the funds, coming up with a policy right now and a method for how the funds would be redistributed to the district. So for example, would it be, you know, kind of like the wish list that the district does with auxiliary, where it's, here's a wish list, and then it's, so that way, because what we need to do is we need to be able to go back to our donors and say, yes, your funds were used for this, this, and this, because that's something that donors want to see. They want to see what their funds were used. So, you know, whether it's, we're getting an itemized report from the district of here's where we're gonna use the funds that you guys gave us, or whether we're gonna pay for stuff directly.
Paid thing.
Yes, like we're gonna pay for a piece of equipment or whatever it is. So that's what we're trying to figure out right now is the best route for that.
So I think, Ethan, if you scroll back up a little bit. Thank you, right there. So that public support, those are donations that we've received for this year, right? So I think, Rich, to your question, on the top section where it says total public support, and it's broken out Q3, Q2, Q1, those three together is gonna be what they've raised so far this year. That was your question, right?
Right, I'm,
So 96,484 for third
At the end of the third quarter.
And
yeah,
that's a rolling number, or is that?
No, so that's a cumulative total. So that's total public support at the end of Q3 was 96,000.
Okay.
okay. And 91 is our expenses.
91 was the loan, is the amount that was, you know, used from the loan to date.
Getting everything set up.
Yeah.
Right, yeah.
Okay. So, is the foundation on a calendar year?
Yes,
Okay, so at the end of the year, you give the district board a financial report.
Yes, at the end of the year, we will give the district board a financial report that has all of the, all of the things and our projections for next year.
Mhm. Okay, thank you.
Which would be our January meeting, I imagine.
Yeah, it'll be in January, February.
Thank you. Anything else you want to highlight?
I think it's good.
Any other questions for Chelsea? Thank you, Chelsea.
Hey,
Thank you.
thanks for coming.
All right, Brady, I think we're back to you.
Okay, so I think the next page was IT. So Ethan, do you wanna highlight anything from your update, maybe your radiology?
Sure, so everything's been fairly straightforward. Radiology project has, come leaps and bounds. Our daytime rates, which is the vast majority, are up to where they were prior to the change. So that's fully integrated, working fine. We're still doing, pretty extensive quality control to make sure that it stays that way. As of right now, daytime reading is moving as expected. For our Nighthawk readings, we are going through a slightly different vendor, they have APR, and we are getting them up to the same point. However, in the meantime, some of the financial impact that we saw for the daytime readings are not occurring with that because we have manual ways of making sure that revenue still flows, even as the specific messages and stuff don't necessarily connect with Cerner yet. We have manual steps in place to make sure that all the information goes where it needs, and that, again, revenue is still flowing as we fix that. Besides that, we did have some progress with the MRI trailer as well. For their first 2 weeks, there was, and this was across all of their sites, we were not unique in it. There were disruptions with them being able to see the worksheets. However, as of their visit yesterday, it appears that that issue is resolved. So now it is working as expected with worksheets and everything passing to and from them and Cerner. So that is going incredibly well, given the technology involved. Besides that, another notable occurrence from the IT team is that we are deep in our interviews for our next staff member, which should enable us to use our resources towards these projects a little bit more effectively amidst the busy help desk scene. Besides that, you'll notice right up there, we have a new access point, and this is throughout the clinic. We are testing these ones because these are what are going to be in the new build. We are consolidating our vendors as far as our network solutions go, so it's more unified, and our team will be able to support it even better than we have in the past, and they have been going very well. Besides that, it's business as usual. Our team's working very effectively within the ticketing system, and projects are being resolved well.
So is that like a modem?
That's an access point right there.
Oh, it's Wi-Fi access, got it.
And we're looking to make our infrastructure all within the same brand of Ubiquity because of all the hands that this facility has passed through IT wise. We had a mesh of different vendors that worked, but when it came to maintaining them and upgrading with warranties and things like that, made it very complicated. So as we move forward, we found a brand that is both cost effective and industry standard for a hospital this size, and we're going to be moving forward with that as our standard moving forward.
So far, so good. We're still up.
So any questions for myself and the team?
Thank you.
Absolutely.
Appreciate it.
Yeah, so I'd like to thank Ethan and his team on the radiology project and apologize to Steve's team on the radiology project because it does hold up cash flow. So when we're holding things and not getting in the numbers that he'll talk, it's, it is when we're doing projects where it has to do with that kind of connection with everything it does, there is some negative effects on those, which, we're beyond that, but it will affect the cash flow until catch up to it, through there. So, when it comes to the MRI, we've been talking about it, so you'll see in the graph, it says 0 because this is as of last month, so we're actually gonna post some numbers on there, which will help cash flow. And then when it comes to partnership, this is still just our standard monthly chart. We've added, Candace has wonderfully put together kind of what was in my mind of, volume communities. And this will help with us, in seasonality. So we talk about, was this busier than last year and, you know, this time of year and where are we at to budget and all of that. So the first two charts, the first one's very, visual in the sense of the dark blue is last year, gray, blue is this year, and the budget line of where it is. So that way you'll be able to see the seasonalities. And really our seasons are November, you know, we're going down into it. Blue hasn't, you know, hit yet. And, so when it comes to November is always a lower month, as is February. February is a short month, so. Also on Steve's side, because of the IGT area that, you know, hits the double dip in the same, direction. So this way it will give us more of a seasonality. Did we meet last year this time? So that's that first one. The second one, if you really like numbers and stats. This will, did we meet budget, did we not meet budget, variance and all of that, that's a lot of data. That is on a fiscal year, and then the chart in the next page, that's more of a calendar year. For me, the first two really, my mind wraps around those nicely. This one's good from a seasonality, and when you do it from a calendar year perspective, are you seeing in the last couple months of the year, people using healthcare access like annuals and all of that stuff because of their deductibles and stuff like that? So you may see an uptick a little bit better in this versus the other way. But the first two to me kind of speak to me of all the data I look
It
at.
helps you parse through.
Yeah.
And see what's
type
really
thing.
happening.
So again, this would be a more of a monthly standing because every month there's new data. So just think about it, see which ones you like. We can tweak them like we did last time, but this will be a more monthly, type meeting. And then, we have all of still our projects that are going on. We've, still working on the basics, phones, the voicemails, all that stuff, which is constant. You know, we're hearing a little more chatter, in the last week or so, so Chelsea and I are trying to figure out what's going on. And then when it comes to recruitment, I'll wait, but we'll give detailed,
She already did.
Yeah.
oh, she did, you did, okay.
I can go into the podiatrist.
Okay. So, we had in the recruitment button, which we're actively, doing, I think a really good job in the recruitment, getting candidates. And it's kind of like fishing, you gotta keep fishing and you win some and lose some, you wipe your tears off and go after it again. So we had, kind of three good potential recruits, one podiatrist, one ER/primary care, and one primary care. I mean, we were feeling pretty good.
We were.
3 for 3, or everything was good. And then something happened in his, family, and so he had to not make a decision right now, which is understandable. The other two, though, we do have our podiatrist that it's where we're working with, PDH on kind of dates and times. The first part of January, he'll be starting, so there's a lot of work on that.
That's great.
He will be clinic, surgery, and long-term care. So, yeah, so that piece is covered, but giving shout outs, since this is recorded to PDH and Karen over there, they did a phenomenal job sourcing, and then we did a phenomenal job collectively together. Getting, you know, we were talking daily on, you know, what you heard, what we're doing and all that stuff. So it was a very nice, good process for that.
So between the two sites, will the podiatrist be full-time then?
Yeah, yeah.
Okay, wonderful.
No, so that is really, it was really nice. It worked out really good. When it comes to our ER provider, that's also our primary care, he'll be starting in January. That's our last, what I call full-time position in the ER, so our complement in the ER is looking really good. And we have access in there to fill holes and vacations and stuff like that.
Right.
And even the last couple, local doctors that we do use, they're kind of steady doctors, so I mean, we've been using them for years. So the whole group is, I feel very, very good with what we have on there. Our clinic, we will, with that provider, will get some capacity in the clinic. It will still not offset Dr. Ware's capacity as she retires, but we're actively looking at recruits or other different models to address that.
We can certainly absorb in the other
Oh, yeah.
clinics. as
Yeah,
well.
we can
Absorb that
absorb.
volume pretty safely.
Yeah, so some of the models that we're looking at is, we have a great, panel of primary care that are all family medicine trained. A lot of them will, like, the doctor we had this summer will cross over between the walk-in and there, but they'll also supervise, and they're heavy hitters when it comes to medicine. So there are some things we can kind of extrapolate so we can get some coverage and the medical coverage we need and stuff like that. So we're looking at different models as it comes to long-term care, when it comes to swing beds and stuff like that. So still a lot of good work that we're doing, but I'm feeling pretty good about it. The other one that we still have out there is cardiology. That's kind of the next one, kind of in the chute. And then we'll be tracking, we'll get to more of our strategic design on what's next as we map out the next couple of years, so that we get a new building, but we keep going, because that is just a moment in time. We got to think about what's 5 years from now. So that's kind of what we're laying out in that. And I think that's all I have, if there's any questions.
I just want to clarify, the primary care ED doc that's coming in January, they're not doing clinic, or they are?
They are doing.
They are doing clinic.
Yeah,
Okay.
so he is, they are originally from Northern California. They don't currently live in the state. So the first couple of months, he's gonna be coming in,
Mm.
but then after they actually get back here, they will be in a more permanent
Got it,
setting.
Okay,
So it's kind of a two-step process. with
makes
him.
sense.
Yeah. And Judy and I had a great dinner with him, and I think he'll be a good addition to the group.
Wonderful.
Yeah.
Any questions for Brady?
This real quick comes to my mind, because somebody just asked me about it, but are we still looking for housing for some of the people that are coming in?
Yeah, we're always looking, we have kind of our internal list. So as we get notified of, between Shannon and Chelsea, notified of housing coming on the market, rentals, short-term rentals, long-term rentals before they actually hit the market. We have a running list that Chelsea kind of keeps the master list. And we'll provide that for recruits that are coming in here.
I have a gentleman that just bought a house and has gone through and remodeled it and is getting ready to rent it out. And he was very interested in
Yeah,
the fact that he knew we needed
yeah.
housing, so
Yeah.
I'll have him contact you.
Yeah, have them contact me, and what we do is we add their information to a list. And then that's the list that we give to new employees, or if we have, like, we need to find housing for a traveler or whatever, we reference that first. So that it's not, it's not necessarily we're gonna rent it from them. It
Right.
might be the doctor's renting it from
Yeah.
them, or the dietitian, or whatever it is. So, yeah, just give them my info and then we'll get them on.
That list would have been really nice to have had when I moved here.
Right.
Even if it's just a temporary, while you look for something to buy.
Right, and we put both on there, and we then put details of whether it's temporary, short-term.
And that's really our recommendation when they first get here, is settle into a rental for a while and learn every community.
Right.
Because you're gonna wanna know where to move.
Right. I want the board to know that I had a great meeting with Brady. You have such a good handle on the provider, the different provider and staff strengths and weaknesses and how best to pair them together. I was just really impressed. You really have a great handle on it.
Were you gonna say something about the old building? Did you mention that earlier, or was that
What's that?
one of you, I thought earlier in the meeting,
The inquiries
about
about
the
that.
hospital, said something about the old hospital,
He did.
about there being some ideas.
Yeah, I thought you did.
Later? Okay,
Later?
all right. Moving on then, any other questions for Brady? All right, thank you, Brady. Okay, looks like we have Charlene's compliance report. Is Charlene online?
I am online.
Charlene, go ahead, thank you.
Okay, so I'm just gonna go over a few highlights and a couple of things that I forgot to put on my report. As far as privacy, education, we are at 83% complete. We hope to get that rate higher by, or be closer to completing, after the medical staff committee meeting. I will be providing, privacy, education to med staff. So the next item, I'm just going over a few highlights that, these are about the monthly, the work plans that OIG has. I'm just gonna let you guys read that one. So I'm going to risk assessments. The three items that we're looking at is healthcare, cybersecurity breaches, and Cora is fully in place. Ethan is working on providing a report to us monthly, and so we should have something to provide you guys next time with that information. As far as registration, to ensure that patient demographics, including are up to date. As far as clinic registration staff, they're having staff or patients acknowledge the face sheets to ensure demographics are correct. Hospital staff continues to validate verbally at the point of registration. However, recently we've added in going through and QAing every single one of those documents where we have a registration form. QA is also assisting us with that if they catch it first, or then they notify us. We actually have a shared file where they update that file, and we review it weekly to ensure that we're updating the information as each week that QA provides us. And then the third one is a verbal authorization signed before we discuss the patient with family members. The form is currently under review and revision, and so that should be coming through as a policy. The two items that are not on the list are the HCI reporting requirements, which does hit compliance. The first one is a hospital fare billing. Last board meeting, you guys approved the policies that we needed to update and change so that it's easy for the patients to understand our policies and for our forms to align with HCI requirements. We're awaiting for a response from them. They did receive it on 10/6. That was the due date. They received it on that day. And then as soon as I receive a response from them, one of the questions we had, or I had, was specifically for the different languages that require 15 different interpretation or different forms that are available in 15 different languages. Currently, we only have it in English and Spanish, and so we'll see what they say about that.
Did you say 15 different languages? Yeah. Can you?
The most common ones that CMS has listed. And so we have a list of that currently. Even our hospital for discharge instructions, we have those available in those top 15 different languages that has been identified for California. So, yeah. I'm waiting for their response on that. The second item that we needed to submit to HCI is a hospital equity measures report. That report is available. It's over 35 pages long. It is available on our website. If you go to senecahospital.org and search for equity, and then when you get to that equity page, there's like a link, and you can just click on that link. And what the Hospital Equity Measures Report is, it's a statewide initiative led by, HCI. It's a requirement by through Assembly Bill 1204. So it requires hospitals to annually report data on patients' access, quality of care, and health outcomes. And it's broken down by race and ethnicity, language, disability status, sexual orientation, and gender identity, and also insurance type. So we had to submit that information, but we couldn't really, because our data or our sample size was so small that publishing it, they felt like it would expose patient information. And so they had to suppress all of our data. However, what we did, as far as a multi-departments, we did respond with priority areas specific to our current needs of the facility. So for each area, for example, what our priority areas are in patient-centered care, patient safety, addressing patient social drivers of health, effective treatment and care coordination, and access to care. Again, this is all available online. I don't have the report attached, and it slipped my mind, but it is on senecahospital.org. You search for equity, and then there's a link on there, and it's over 35 pages of report.
Well,
And
Charlene, what's the state doing with this data? They're requiring us to provide it, but what are they?
as far as that, at this point, they're trying to identify any disparities in healthcare and access across different community, and they're promoting equity, and they're hoping the hospital would also take this data and take action to close any gaps in care. And then also it provides transparency, as HCI is publishing this report, and we're also publishing it, and what are our plans, and also empower our communities to advocate for better and fair healthcare.
But didn't we just say we're suppressing the data from it though?
They have the data, they're just suppressing it from posting because
Yeah,
it can be
publicly.
skewed and we're so small and it can be, there's a potential for,
Their side, but
this
we're
is
still putting
the
it on our
whole, HCI's charter to take a look at social determinants of health.
Pop health.
Right, it's a pop health social determinants, so that underserved areas, they can consider how they're going to address things like OCA and all the other things. So this is their study.
Okay, but let me get back to one other thing that I'm just, so we're saying that they're not publishing our data on the HCI website, but we are still publishing the data on our website?
No, they are publishing it. It's just the numbers, the total numbers were suppressed.
So
like you can see it, it's blank. However, our plans are all on there. If that, I know it's.
I'll have to look at it.
You see the report,
Thank you.
we answer the questions about how we manage certain things and the social determinants. But we don't have our numbers in there because they're so low.
Thank you, Charlene.
Yeah, and when you look at it, there's odd characters in front of it, and that is just when it's a known issue within the HCI application. So when I did submit it, the report looked beautiful, but then because we had to submit it in CBS or a certain format, by the time they converted it into their report, it added weird characters, and I contacted HCI, and no one responded back to me as far as, what am I, what can I do to fix those odd characters and, where there should be bullet points or there should be spaces. And so it's not that we didn't try to make the report. We didn't make that.
Yeah, I've seen that happen before on stuff, so it's okay.
Yeah. Okay. That's it for me.
Okay, thank you. Any other questions for Charlene? No. I thank you, Charlene.
You're welcome.
All right. That brings us to Steve's CFO report. Steve, are you on?
I am.
All right, take it away.
Doke. Okay, so we're talking about the month of August, 2025. It's second month of our fiscal year. Ethan, if you could just spin to page 2, we'll just kind of get into the detail of it. For the month of August, we had a total net income or net loss of $400,284 versus a budget of $266,871 for a negative variance of $133,000. The negative variance was driven from the revenue side, where both our gross patient revenue and deductions to revenue as a percent of gross patient revenue were negative, which in turn led to a negative net patient revenue of $179,263. The negative variance within revenue for August, which is a little concerning, is that our outpatient revenue was the driver on that, where outpatient revenue was negative $153,774 to budget, as opposed to inpatient being very near budget. So couple things about this is one, we did see a little bit of a bounce back in revenue into September, where we're a little closer to budget and only slightly negative on an outpatient basis. But as I mentioned in our treasurer's meeting this past Tuesday, is operating around budget is good, but it's not great. It's not going to be the financial model that's going to sustain the debt service on our new facility when we open it in 2027. So we have to continue to focus on driving more revenue. And there certainly, as I've said before, there certainly are opportunities here, both from the inpatient and the outpatient side. Our inpatient continues to be low. We did work right around budget, but at the board's direction and a reasonable approach is that we set the budget quite low and the bar extremely low on those service lines and revenue streams, because that's what we're running. But again, there's opportunity within both the acute med surg and the swing bed, but there's things that we need to do. And we've talked about the hospitalist program through the emergency department to support appropriate admissions of patients, and then the recruitment of therapy providers to support our swing bed program. But these are things that we have to continue to have our focus on, not just for the current year, but as we, again, move ourselves towards the new facility in 2027. On a positive note, I guess, is that we are managing our expenses to budget. The professional fees medical were one of the items there that had a positive variance. We had a provider off for multiple weeks within the month of August, which again could be a contributing factor to to the outpatient variance, although the clinic visits were not down disproportionately both to our budget. We saw that the diagnostic services across the board were pretty were negative to budget, and that's something that is not entirely predictable or rational, that not every patient's going to require, or every patient's going to need diagnostic services associated with their care at Seneca. So sometimes it works, or sometimes it relates, and sometimes it doesn't. But we saw it in the month of August where that wasn't the case. We did talk about MRI, and having MRI back online here in October is going to be a big plus for us, especially with the numbers that we're seeing now. We're seeing higher volume than we did when we previously had the MRI service. So hopefully we continue to see that type of utilization, especially with having it here once a week. I think will be a huge benefit. As in the past, our interest income outperformed budget. This interest income is being driven off of the funds that are held in our trust account for the project, mainly due to the fact that at August we hadn't caught up with the disbursement of project expenditures, which your materials for this board meeting that run through October show that we are now have distributed through the month of August and preparing to distribute for the September draw. And we paid the soft costs. So that's really it for August. Questions, comments, any thoughts or?
Board members? No, it doesn't sound like it, Steve. Thank you.
Okay, yeah, it's a pretty similar story. So
You want us
now-
to vote to accept the financial report first?
if you would, please.
So moved.
That would take a motion. Oh, thank you, Rich. Do I have a second? Thank you. All in favor, Rich?
Aye.
Shelley?
Aye.
Sherry? Aye. And I'll vote aye. Okay, so now I think we're on September 2025 preliminary financial analysis.
Yep. We're not able to produce full financial statements for September, but we're able to get a pretty good snapshot of most of the elements, with the exception of the expense side for the month of September. And as I mentioned before, the revenue did do a bounce back. As you can see that our total patient revenue was positive to budget, just over $42,000. What's interesting is that all the inpatient bashing, the positive variance was driven off of inpatient. And in the case of long-term care, looking back to August, we had a rare dip in our census in long-term care, but as per usual, it always comes back, and you can see we're very close back to budget in the month of September. So again, outpatient was just slightly below budget. Outpatient revenue was just slightly below budget. And again, if you consider the amount that MRI was off due to not having the service in September, that essentially brought us back to budget. One thing that we did note and discuss in Treasurer's meeting again was that we've seen a large drop in the wound care, the wound care surgical procedures that we saw a lot of in 24-25 that we haven't seen so far in fiscal 25-26. And that's where they do the skin substitute onto the patient, and it's a fairly expensive product. And so there's when you look at the outpatient revenue and you see the big negative variance for central supply, that's the decrease in the use of that skin product, which is quite expensive. So
Steve, I have a question.
Sure.
I have a question, sorry, like, we're on the same, one of two for September. Under inpatient revenue ancillary, what is that? Cause it was definitely, above budget.
And yeah, it was from a med surge patient. So it was a med surge patient that utilized a high amount of ancillary services. I unfortunately can't tell you what their admitting diagnosis was, or
Fair.
what they were, but as opposed to coming from the swing side, it came from the medical surgical side.
Would that include meds at all, or like
It would good pharmacy,
drips, yeah, and stuff like that, okay.
absolutely. So yeah, that was interesting because that was definitely off of, you can see that the days from August to September were pretty similar, but the ancillary revenue was quite a bit higher. So let's see. And Ethan, if we could just scroll down. Oh, oops, sorry, not too far yet. So one thing again, we discussed in the treasurer's meeting is right now, I've just done kind of a preliminary allowance for contractual adjustments and uncollectible accounts. And as you can see, it's the net patient revenue came in at 65% versus a 65.3 versus a budget of 72.48 or 5. And that's really just driven off the growth in the AR. I'll talk about that here in a minute. And so that number may change because we can do an assessment that we say just because the AR grew and aged out a little bit, that it's not necessarily indicative of it not being collectible. It's just indicative of what we experienced in the month of September. So Ethan, go ahead and slide down to the bottom. And this was weird because I had to look at this a couple times. Our ER visits were down to 235 versus 287 the prior month. And our ER revenue was actually positive to budget. And so it's just indicative that the people that came to the patients that came to our ER had a higher level of care. And the reason I bring that up or try and equate that is I say, are people going to the ER that aren't going to the clinic, especially when we see a month right below there, we see our clinic visits drop down to 850. So sometimes when we see a drop in the clinic visits, we say, well, maybe they're going to the ER. And, two things. One is that the ER visits didn't go up or there wasn't a proportional increase in the visits. And the amount that was driven off of the ER visits per visit is quite high. So that just, to me, says that those were really emergent cases where the patient needed to go to the ER. So the big thing for the month under accounts receivable, as you can see, our AR grew. Ethan talked about what we experienced with the radiology, and in short, due to the transition to the new radiologist, teleradiology vendor or group, that we were unable to bill for any claim that had an imaging service on it that required a read, because the pro fees were not coming back to us. So we held all of those claims for the month of September. As Ethan also reported, we did get many things resolved in October, including finally getting Cerner to admit that there was a workaround on this that Ethan had asked them about when we first had the occurrence of this back in September, at the beginning of September. He said, hey, is there a workaround? They said, no, absolutely not. So we held all the claims. And then when we got into October and still we're struggling to get it to work, we made the decision to just start sending the claims out without the professional fees on there. There's a couple payers, Medicare and Medi-Cal, that require to have both the our facility charge and the professional fee charge on the UB facility form together. And those will have to just write off the pro fee, because we don't want to turn around and resubmit the claim with the pro fee and have them take back the claim, and who knows what they'll do with it. You know, we're not really, the stars aren't aligning for us right now these days. So we're not gonna spit in the wind on this one. But the payers that require a split billing, where we do the facility on the UB form and the professional fee on a HICFA, will go ahead and bill out those pro fees separately. We don't have a final number of what we had to write off, but we will at some point here. This, of course, also, as AR goes up, it has a direct impact, as Brady mentioned, on cash. And we did see that decrease in cash in the month of September. So that's really it, the look at September. Again, September is going to come in probably around budget. And I'll just go back to good, but not great. Questions or comments?
Thank you, Steve. I think we're good for the September 2025 preliminary. Did you
Thank
want to
you.
highlight it from the updated cash flow?
Yeah, just a couple things about the cash flow. Okay, so thank you. What you'll see that, and some pieces fell together after this was sent out, and I did an update. We had a better picture of what our growth in AR is going to be for October, and so we're looking at the end of October. Between September and October, we're looking at probably about $1 million, 400 in September and 600 in October, related to the radiology billing. Now, in September, it was all in discharge not found and billed. We're just literally sitting on it. Now into October, we've billed it out, but it's still sitting in outstanding AR and not in our bank account. I have done some projections, some crude projections about how we will recover these amounts up there in the top, right below depreciation, that in the months of November and December we'll see the recoupment of these funds. We ran into one other issue with our billing with Partnership for Long-Term Care. They did an amendment to our agreement with Long-Term Care, so that all of our long-term care encounters would be considered contracted, which is very critical, because the contracted encounters are what's counted into the DHDP supplemental payment program. And for us to not have that would be a huge impact, especially when we go into calendar 25, when the size of the pool quadruples. So we went and did that, and somehow as we were doing that, somebody changed our PO box for mailing the checks, and all the checks were returned. So we're sitting on a couple months worth of long-term care AR. We're coming down the home stretch on that one this week. Again, I can't say enough about Partnership as far as them jumping in and working with us, both with the contract to get the long-term care encounters added, and then now to help us with get the PO box, the mailing address fixed, and hopefully an expediting of the payment to us. It's just, people are available, they respond to you, and it eases the pain of having things like this happen. So again, I enjoy working with Partnership, and look forward to continuing that. But the big thing here is, as we talk about capital expenditures, and Ethan, if you could just scroll down a little bit so we can get the days cash on hand. So just like we did last year, but not to the extreme nature we did Our cash is gonna dip after we do our intergovernmental transfer in November, the $2.8 million. And we really are not, we have to kind of hoard those reserves. We have initiated the process of getting a line of credit through Western Alliance Bank like we did last year. This one will be for multi-year, so we don't have to redo it, but they were adamant last year, they were new to us and everything, and we convinced them to do that on a very short-term basis, and it expired. But we are putting that forth. But the big issue is our attorneys say that we cannot issue that debt instrument, even though it's very similar in nature to what was done previously, without the specific approval of the USDA. And obviously, they're part of the government shutdown, and we don't know when they will return. So in the absence of that line of credit being in place, we have to be extremely tight with our funds until we start to see the supplemental payment back from partnership, most likely in the month of January.
And Steve, this isn't one of those things that we can move forward with bless afterward, and if they don't bless it afterward, we close it? We couldn't do something like that?
You sort of broke up. Did you ask if we go,
Sorry.
if we can go ahead and do it and then the USDA reviews it afterwards? Is that what you asked?
Yeah, basically, and if for some reason they say no, then we say, oh, okay, and close it, which I don't see why they'd say no, they said yes last time.
Yeah, the attorneys are of the opinion, our attorneys are of the opinion that this is a different agreement and it absolutely needs to have sign off on them. They're just saying there's really no flexibility here. So that's what we're going with. Because they say, yeah, the attorneys say the problem is that if we issue debt without their concurrence, that we could be in violation of the letter of conditions. And that is absolutely the last thing we want to do, because
Yeah, no, I get that, Steve, but what if we had it open, but we didn't draw on it? Right? Why don't you send me the last email that you got on it and let me look at it if you don't mind?
Of course.
Thank you.
And I did roll over pretty easily on that one, so I can push.
It's all about the semantics, Steve. Right.
I can push BBK on that.
Thank you.
But I think we're two things, whatever. There's no way that the government shutdown can go on much longer. The rubber's hitting the road with SNAP and WIC and those types of things. And the government employees, both working or not working, are going to miss their first full paycheck. I don't think it's going to be a very, very pretty picture. And Rich mentioned, I think they're using the election in Virginia as a pawn in this, that, whoever reopens the government, because the Virginia has 100,000 federal employees and they're whatever. And so I think this will get it resolved. And we really aren't in a big pinch until later in December. So we still have 6 weeks, almost 2 months before we would really hit our difficult point as far as cash on hand. But I think the bottom line is we don't have any reserves for spending other than operations until.
Point taken, Steve. I'll just look at the email and then formulate what I would say if we don't get back with the government open shortly. How's that?
Now that's a different perspective. Yeah.
Okay.
that if they I totally agree that if, at what point does the rule book go out, it becomes survival.
Right.
So I clearly hear you there. Okay. That's really all we have there. So the next thing is the R1 report, and you know, you guys can say, yeah, we already heard you, Steve, but it really means a lot to the revenue cycle team to see the progress, and when our numbers start showing that everyone's efforts are coming together to produce results. And so it's also likewise important to point out that when things turn on us, that that we point them out and say, hey, you know, this is not on us. And so I look at the line, the total AR days, you know, we had brought it down to 76.6 in August, which is pretty amazing considering how much self-pay we still have out there. And then you see the jump in September to 81.5. And moving down the insurance AR for August, we were, and this is the third party stuff. And so this is really, this is what pays the bill. Self-pay doesn't pay the bills. Third party AR does. And we had it down to 47.9 with a target of 45, which, you know, is really great. And then boom, we get hit with this, and now it jumps back up to 51.2. So I just think it's incredibly important to, and here's kind of where it says, yeah, Steve, right, with the numbers. If you go down a couple more lines and you look at insurance AR greater than 90 days, this is where you can see that it really was just this temporary thing, because look at our AR as AR greater than 90 days as a percent of the total was still right around the 1920 and below the target. So that's a really important measure. And this is a very technical measure, but down the bottom, the client assist, this was something that R1 really pointed out and really said, bravo, even in the midst of what was going on in September, that our client assist, and this is when R1 has returned an account to us because something has to happen, whether we need documentation from a provider, whether we need you know, a charge or coding or something done to it that we have to do that R1 can't. We dropped it down to 5.8 days, which is, you know, as you can see, it's green. I think it's just green because it's such a good number. We don't even have a target. So, but it's not been that low. And so it's really important. So just briefly, Ethan, if you want to just flip to the next page. And this is where we got hit. So 2 months ago in July, our discharge not final billed, our unbilled AR was 8.9 days, which is really, really good. You can see we have a target of 12, which I think is high. I think it doesn't need to be that high, but 8.9 is a fabulous number. August, we ran into that thing where Noridian just denied every claim because of the assignment of benefits issue they were dealing with certain provider or certain providers. And so we jumped up, but here we went up again and we're at 19.5. We haven't been at 19.5 since, you know, since month 4 post Cerner. So that was a big thing. And just Ethan, if you could go to like about slide 20, I think should have wrote it down, but just, yeah. Hey, look at that. Okay. Two more slides then. And so here, this is the clinic. And so we don't have the radiology issue within the clinic because there's essentially no radiology imaging services done in the clinic on clinic patients. So here you can see the discharge not final bill is 8.8, 9.8, 8.9 versus 19. So that was where our hit was on the it was on the hospital side. So those are the only things I wanted to point out. We're going to see, we'll see the discharge not final bill go down in October, but the AR is going to still stay high. So stay tuned. And then the last thing is just the update on the interim financing, which is through October. And Ethan, if you want to just go to that one real fast. it's a separate document.
Second document.
Sorry.
Thank you.
Yeah. So in October, we did a couple things and just, this is just a visual, the details behind this, and we'll just not go into it. But in October, the big thing is that we finally were able to pay the soft costs that had been two things. One that had been held since April, and then we also were able to reimburse Seneca for the soft costs that we paid through April a couple of months back. So we're current with all of our soft cost vendors, which are architects, inspectors, Donna, Huntingdale, and the like, legal. And then we have done OR 14, which was the August general contractor payment. And now Donna and I are working on OR 16, which is the September contract payment, which I think looks like we'll be able to send off to Western Alliance Bank today. And we should have money in the next few days. It is a pretty big, outlay request, a lot of subs on it, obviously, with all the work that's going on. So I could understand if it's going to take them a little bit of time to go through it. So, but after that, we'll be current, and then we'll be looking for October draw requests from both the soft cost vendors and Monley Hamlin, our general contractor. So this really was the silver lining on the government shutdown, is that we've been able to push through these payments and get current with especially Monley Hamlin to keep those subs paid and those subs moving before winter hits. So that's been a very positive. So that's it for everything. Questions or comments?
Wonderful. Thank you, Steve. Any questions for Steve, comments?
Nope, thank you, Steve.
Thank you, Steve. Appreciate it.
Mhm. You're welcome.
Okay, that brings us then to item number 9, New Critical Access Hospital and Skilled Nursing Facility Contingency Usage Request 009. I think I saw Donna on there. Are you with us, Donna?
I am.
Oh, there you are. We got you.
Alrighty, so what you're seeing are requests for construction contingency. The memo is the summary of all of those, and we can dive into any of them as needed, but this has for the just kind of ticking through each one. The first 3 are asking for requests from the board, and the last 2 are approved via the board resolution 452, being less than the 25,000 that can be approved by CEO by unanimous CEO CFO approval. So I'm asking for approval from the board on 33, 34, 35. 33 is the increase of the generator capacity from three 350 kilowatt generators to 3 400 kilowatt generators. It went in the transition of the electrical engineer of record. It was determined that we needed this. It wasn't a nice to have. It was a need to have to make sure that we're covered for now and have remaining capacity for any for the expansion that could happen to SNF in the future. The second line item, request number 34, is corrections similarly made by the new electrical engineer of record for scopes increments, or for increments 1 and 2. Does not include increment 3. There's another request that'll be coming down the pipe for increment 3. And request number 35 is for envelope revisions. Reason being is when we have a commissioning consultant on board, but with the timing of having rebid
going from design build to design bid build and all the timing of that all going on, this effort by the commissioning consultant to do a full review was delayed, and so it was after bid, and the resulting changes are reflected here in this 260,000 to make sure that we have all our experts bought into the waterproof nature of our skin of the building. With all of these 33 through 37 incorporated, the owner's contingency doesn't change because it's the none of these are for owner's contingency, and the construction contingency remains at 4,652,623 and 86 cents. And with that, I'll take questions.
Thank you, Donna. First, Sarah, I want to ask, is that more how you were expecting the agenda item to read?
Yes.
Okay,
Yeah.
okay, just want to make sure.
No, that's really good because it does make it much clearer to anybody that might be going, what the heck is $297,000?
Okay, good, good. All right.
So I don't want anybody to pass out. But I move approval.
What? I'm gonna pass out right now. All right. Second, are there any questions before we do the final vote? Comments? No? Okay. All right, Dawn, I guess we're gonna go for approvals then. Rich, do you approve? Rich, are you still with us?
You probably passed out.
Yeah, on mute. I was on mute. Yes, aye.
Thank you. Shelley? Aye. Sherry? Aye. And I'll vote aye. Yeah, I don't think he expected that to happen so quickly. He's like, where's my mute button? All right, so thank you, Donna. That brings us to item number 10, New Critical Access Hospital Skilled Nursing Facility General Update.
Yes, so just going through the board report, nothing to update for the schedule or budget other than what we just discussed for the contingency usage request 9. No true updates on permit. We're still waiting for the county approvals for the driveway changes into the building. Medical equipment, following the board approval of the equipment list and associated budget at the September meeting. Just wanted to give the board an update that there was an equipment purchase order cut for Philips. And by the process that's been put in place, we were able to do that pretty expeditiously with the appropriate review, but expeditiously, and ultimately saved 5% in cost increase. So that's great. And so the plan is to be able to report to the board where we stand with different purchases of the equipment against that list as we move forward. So I'm developing a spreadsheet, working with Brady to develop the spreadsheet that can best report to you guys where we stand with the purchase of that equipment. Right now, it's just that one, so I haven't developed that document quite yet. We have 2 meetings arranged next week to work with 4 of the architecturally significant equipment vendors to make sure that we're incorporating delivery of their needed items that need to be installed by the contractor. So we have 2 different meetings set up next week to do that. And we'll continue to coordinate with those individuals. Construction, still working toward dry-in winter of 2026.
Donna, don't you mean 2024?
25. Oh my gosh. Thank you.
I read that and I was like, wait a minute.
We're not that behind, are we?
I'm so sorry. 2025. Just giving people heart attacks all over the place, right? Yeah, so winter of 2025, still working toward that. We did have we tested our mock-up that you may have seen toward the entry of the site last Friday, and we're working through the details around making sure the windows are installed as needed. And so that is the next step to working toward that dry-in, and of course the roof being ongoing. I think you've gotten the update on the support services building from Sean and Chelsea, so I'll skip over that. Financing, I think you've gotten the update on that from Steve, so I'll skip over that. And he is correct that we're I do have all the documentation now to be able to submit that outlay request 16 today to Western Alliance Bank. So I'll send that to Steve for signature as soon as I get off here, and then we'll get it to Western Alliance Bank after that. And then I added a swim lane of licensing staff and stock. Wanted to update the board that we are finalizing the solicitation that we need to put out for a consultant for that transition and activation planning, and looking to bring that back to the board for a recommendation in November. And I think that is it, and I will take questions.
Great. Any questions for Donna? No, we're moving along swimmingly.
All righty.
Thanks for your work, Donna. Appreciate it.
Bye.
Okay. That brings us to item number 11, policies and procedures. Any questions, comments? Move to review, move to approve? Move to approve. Thank you. Do I have a second?
Second.
Thank you. All in favor? Kelly?
Aye.
Sherry?
Aye.
Rich?
Aye.
And I'll vote aye. So that brings us to item number 12, medical staff report. Requesting board approval. Medical staff appointments is approved at the October 14th med exec staff meeting. It's like we don't have any initial appointments, but we have a number of appointments. And I'm not sure what the note means, so,
Just Dr. Taylor tired.
oh, okay. So that's not part of the appointments, though.
No,
Okay,
he won't be seeking reappointment.
got it, okay. All right, so then with that, I will accept a motion to approve the appointments as listed.
Move approval.
Thank you. Do I have a second?
Second.
Thank you. All in favor, Rich?
Aye.
Sherry? Aye. Shelley?
Aye.
I will vote aye. And that brings us to our closed session. All right, we are back in open session. During closed session, we met pursuant to Government Code 54956.9, conference with legal counsel. District has received a claim in connection with the replacement critical access hospital and skilled nursing facility project, which is available for public inspection. Trade secrets, health and safety code 32106, reports involving trade secrets. Litigation, pending existing litigation, conference with legal counsel, existing litigation pursuant to government code section 54956.9D1. Simon Rentera versus Seneca Healthcare District et al. Claim and case numbers are on the agenda. Public employee performance evaluation pursuant to government code section 54957, public employee performance evaluation, title Chief Executive Officer. And with that, that moves us to item number 14. There were no reportable actions taken during closed session. Future board meeting agenda topics, we still have a board planning session that eventually I hope to do. Anything else anyone wants to add? Okay, hearing none. Our next regular board meeting will be on Thursday, December 4th, because of the Thanksgiving holiday at 2 p.m. here. And with that, our meeting is adjourned.
Good.
Thanks, everyone.
Thank you.
Take care all. Bye.
Thank you.
Bye.
Bye, Rich.
It's already on.
There's a pause, stop recording on the red line. Oh, are you gonna video?